Alrighty, now we're going to do part 2 of chapter 11, muscles of facial expression. Look at all these muscles that you have in your face. Remember I talked about this in class. I missed class. I can't give you all these expressions and stuff, but it's RBF, remember? Resting, you know what, faced. Well, when they have that, all these muscles are contracting and pulling their lips down. You've got the buccinator. This is what you use when you're taking your selfies. The duck face. You have the orbicularis oris. You have the plasma here, the rhizoris, zygomatic, minor, major. Now again, you have to only know what I gave you on the OIN list, but I just wanted to show you that there's a lot more muscles in the face than what I made you responsible for. If I made you responsible for every muscle there, it'd be about 600 muscles, and you'd curse me even more than you already are. All right, you have the occipital frontalis right here, which is when you raise your eyebrows. So frontalis elevates the eyebrows. The orbicularis oculi closes your eyes. The orbicularis oris closes your lips. So zygomatics major and minor raise the corners of your mouth for a smile. And the rhizorius expresses horror. Oh, like what you get on your report card. Oh no, I'm just kidding. You guys are going to do very well. But again, these are just examples. Go by what I gave you on the OIN sheet. Those are the only muscles you're responsible for. But I wanted to show you there's more to the muscles in the face than what I made on the list. Oh, look at that. That's a great picture right here. I mean, this is amazing of all the muscles that you have in there. Now, unfortunately, as you get older, guess what? All these are going to start to sag. Yes, that's why you get wrinkles. You lose the collagen and the fat between the skin and the muscles here, and that's why you start to get wrinkles. That's why you'll see people such as Kim Kardashian and all those guys, they'll inject collagen into their face and their lips in order to maintain that young appearance. Here's the masseter. It moves up and down, so when you chew, here's the buccinator, like I was telling you, draws your cheeks in together that give you that duck face when you take your selfies. Orbicularis oris, you've got the orbicularis oculi, the frontal belly here, occipital frontalis. You've got the temporalis here. Okay, so these are really good muscles here. It's a great picture here. All right, and then chewing and swallowing, you've got the ganglioglossus protrudes the tongue or moves it to one side. The hypoglossus depresses the tongue, and the styloglossus pulls the tongue up and back. And again, I don't have that on the OIN, but I did want to show you that, hey, there's a whole bunch of muscles. Look at all these muscles underneath your tongue that do what they do to move your tongue up and down. It's amazing. Okay, duck look. Okay. All right, so muscles of chewing and swallowing, you've got the temporalis, masseter, and the medial pterygoid, which elevate the mandible and move it sideways. So the medial and the lateral pterygoid, if you grind your teeth at night, these muscles become really tight. So if you grind your teeth at night, you should really look at getting a mouth guard. That can lead to TMJ issues. All right, so the lateral pterygoid, probably one of the important muscles of your jaw, depresses the mandible and moves it sideways. Muscles of the neck, digastric depresses the mandible. You have the sternohyoid that depresses the hyoid bone, and the sternothyroid that depresses the larynx. So again, we talked about the hyoid bone and the importance of strangulation and hanging, but you do have a lot of muscles that will protect your airway. So what happens is when people do hang themselves, unfortunately, again, this is morbid, but you have these muscles that the rope has to go through in order for it to get to the trachea. So what happens is it loses the blood supply to the brain. The brain relaxes the muscles, and once the muscles relax, then it can go through and compress the trachea. So you do have some protection here. Okay, so here's some more muscles of the neck. You do have to know the sternocleidomastoid. It rotates the head side to the side when unilaterally active, draws head forward when bilaterally active here. Okay, so when you bend your neck forward, the sternocleidomastoid is working, but it rotates the head to the side when unilaterally active. Okay, so the left sternocleidomastoid will rotate your head to the right. Here's the muscles of the shoulders, the trapezius of the neck, traps. Okay, if you like trap music, Trap music's interesting, wouldn't you say? See, this is the part of class that I missed, the interaction with you guys. It's not the same with online, but we'll get through it. We're doing the best we can. All right, the diaphragm, I would say, is one of the main muscles in the body that we sometimes forget about, but that's your breathing muscle, which is the diaphragm, okay? If you take a deep breath in, you can take a deep breath in, but exhale. Exhalation is key. When you exhale, this diaphragm domes up. Okay, when it domes up, a lot of the muscles relax. So practice not only inhaling, but actually the key to relaxing a lot of muscles, especially in the neck and the low back, is exhalation. Learn to breathe out. Exhale on a long count. So if you inhale, count of 1, 2. Exhale to a count of 4. A long exhale is very beneficial. Do that a couple times a day, a couple times an hour if you can.
Intercostal nerves.
So if you look at the internal, external muscles, those are very important in breathing. You've got the rectus abdominis, which is where abs. People always want abs, right? Transverse abdominal compresses. Again, the transverse abdominis is take your belly button sitting here and try to suck it toward your spine. Now, in order to see your abs, I mentioned this in class. Everybody has abs. People say, oh, I don't have any abs. Well, if you didn't have abs, you'd fall straight to the floor. So everybody has abs, but we just have a layer of fat that basically is on top of this. But if you look at this, you've got the rectus sheet. Okay, you have transverse abdominis, the deepest layer. You've got internal and external obliques here. Okay, if you look at this model, you want to maybe pay attention to this because this model might show up again. I think you guys took the practicum. I did have a little bit of this on.
Nerves.
I think I showed this in class, but going back to the abs, in order to see your abs, for men, it's about 3 to 4%, 6 to 7%, 10 to 12% body fat. For ladies, it's about 10 to 12%. 15. Unfortunately, when you get to this level of body fat, normal hormones don't really get secreted, so you don't want to be this low in body fat. Okay, so normal is probably about 25-30% here, even at 35%. I would like to stay between 25-30 to be healthy for guys. 10 to 15% here. The problem is if you're at 35, 40, 45, 50%, you run the risk of cardiovascular disease, so heart disease, and you have all sorts of other problems. So that's why too much abdominal fat is not good. Okay, so if you stay in the middle here, 15, 20, 25 for men, 25, 30, 35 for women, I think you'll be okay. Going up here on the top tier, it's probably a little, it's not ideal. For men, 3 to 4%, that's not ideal. You don't have any adipose, you can't regulate your body temperature, and for women at 10 to 12%, your menstrual cycle is going to be affected here. So muscles acting on the vertebral column. Look at all these muscles of the posterior chain. You've got the erector spinae, which straightens the spine. You want to work on these for sure. Work on your glutes, work on your lats, work on your traps, posterior delt. Muscles acting on the vertebral column. You've got the iliocostalis, longissimus, and spinalis. The way I like to remember this is I love sushi. So iliocostalis on the outside, longissimus in the middle, and spinalis again here. So I love sushi. It goes through there. Okay. Right now you shouldn't be eating sushi anyway. Oh yeah, we love the core, don't we? Look at this dummy. This is why emergency rooms exist. That's why you're going to have a job later on, because you have dumb people like this trying to do things that they think is creative and trying to work the core. You don't need to do stuff like this. This is not functional. Okay? I mean, doing a squat on a Swiss ball, this is not even practical. When are you ever going to have to do this? So don't be dumb. Don't do dumb things. Just do regular exercise. Try to do the best you can. I don't even know how he got up there or how he's going to get off this thing. This is, I love to see him getting on and off. Anyways, going right into the muscles of the pelvic floor, you've got the ischiocavernous, maintains the erection of the penis or the clitoris. We'll talk about this a little bit more in the reproductive system, so I'm just going to skim through this, but I just wanted you to know that you have a lot of muscles underneath here. If you have muscle tightness here, it can affect a lot of things, your ability to go to the bathroom, whether it's urination or defecation. For ladies, it's the same concept. You have a lot of muscles down here. You have the deep transverse perineal, external anal sphincter, and what happens is when you have tightness here, it can affect you going to the bathroom during reproduction and going to the bathroom as far as defecation, digestive system, and urinary system. Again, we'll talk about a little bit more of this in the reproductive. But in the meantime, ladies, you can do Kegel exercises. But I wanted to show you another view, which is look at all these muscles that you have in your pelvic floor. And when babies come through this, they overstretch all these muscles because they have to go through this vaginal canal here. So imagine 9 pounds going through this little opening here. It's going to squeeze on the rectum, squeeze on your urethra. All these muscles have to relax in order for that baby to go through. So there's a lot of trauma going on during childbirth. And those that have had babies, you know that it's not very simple. Good luck. Yeah. Here's some Kegel exercises, which are you can do for men and women. Okay, so basically, like I was telling you, gave you the example is pretend you're going to the bathroom, and then you see someone coming into the bathroom, and you stop the flow of urine. So you hold it, and then you release. You hold it, and you release, and that's basically your pelvic floor. Guys, you can do it too. Do about 100 a day, and you should be good. Okay, all right. End of chapter 11. Good job.